Heard from and spoken to Dr. Souza several times during this pandemic, and at this point, as he made clear to Joe, he's not sure there's anything more that he can say. When they had his conversation with him today, he felt like he'd laid it out on the table, not just yesterday, but in all the times we've spoken with him before. He's already said most of this stuff repeatedly. What he said months ago, he reiterated yesterday. He even concluded this caveat yesterday: "I know we sound like broken records," when referring to what he was about to say. Now, despite that disclaimer, there was one thing Dr. Souza said yesterday that caught our attention that we didn't have time to include. He said after 18 months, they, meaning the local community members, medical community that is, they have gotten pretty good at predictions with this pandemic. He said, given the current rate of transmission, we can expect 9,000 Idahoans to get the coronavirus within the next week. Then he went on to say, with about 50% of those eligible being vaccinated, let's assume that means there's an equal chance of both vaccinated and unvaccinated coming into contact with the virus. Equal chance is being generous here because, as he said, we tend to see different behaviors from those who are vaccinated. But the Delta variant has also eroded the efficacy of the vaccine in terms of chance of infection. But for argument's sake, let's go with equal chance. Here's where it moves away from being equal. Dr. Souza reminded us yesterday 90% of the COVID patients they are seeing at St. Luke's are unvaccinated. 98% of the COVID ICU patients unvaccinated. Now, given those statistics, he broke down the vaccinated versus unvaccinated like this.
You guys, even if the numbers stay flat on the rate of rise that we're seeing in the state, 9,000 of our fellow Idahoans are going to acquire the infection this week. Out of those 9,000 people, with those generous assumptions, we might actually expect that 3,000 of them are vaccinated. We would predict out of those 3,000 people that 15 of them will need one of our hospital beds, and 3 of them would need an ICU bed. And sadly, 1 of them might die. In the 6,000 unvaccinated patients, we can expect 300 of those people to need our help in a hospital. And we can expect 60 of them to need our help in an intensive care unit. And sadly, we can expect 24 of them to die. And they are not a statistic. Those are 24 human beings. Now, I don't know their names today, but some of us around the state will come to know those 24 people's names in the 9,000 that are going to acquire it this week. And we'll hold their hands and we'll care for them and we'll know their families. And they're not a statistic.
And you can see the effect of that on his face. How losing a patient, even those that could have avoided death by getting a vaccine, just tears into a healthcare worker.